One of the main challenges of development of effective treatments for brain tumors is that we fundamentally do not understand how the molecular landscape of the tumor evolves over time and with our treatments. So in terms of the personalized medicine, typically what happens is at initial diagnosis, after they get an operation, we test the tissue for their molecular mutations. We try to make a plan, an individualized plan based on that. But we also know that once they go through radiation and chemotherapy, and with time and at progression, that tumor, though from a histologic standpoint is similar, from a molecular standpoint is different. Depending on the institution you go to, you don't necessarily rebiopsy these patients because it's the brain. And it's much more feasible to biopsy a liver or a lung metastasis rather than a brain metastasis. So the irony, unfortunately, is that the tumor that needs the most information is the one that's getting the least amount of information. What we need to understand is what are the molecular changes that are going on as the tumor evolves over time. And I think that until we really understand that much better, we are going to struggle developing effective targeted therapies. Just even a holistic approach in terms of for specialists to be able to say, to look at a brain tumor patient and say, I don't necessarily know what your outcome is going to be. I think that traditionally brain tumor patients, one of the big challenges that they face is when they face physicians who aren't specialists. There tends to be a more nihilistic approach to this and more doom and gloom outlook. Whenever patients, when I first meet them, ask me, how long am I going to live? My honest answer is, I don't know. We're going to treat you. We're going to do the best we can. And your outcome at this point is unknown. There's no guarantee for any of us in terms of what our outcomes are going to be. And so I want to emphasize that to a brain tumor patient. I don't know right now what it's going to be either. There are always going to be statistics, but those statistics do not predict individual outcome. So for you, I don't know what your outcome is definitely going to be. So let's go ahead and treat, and let's be aggressive, and let's fight.